Throughout the years, there have been a lot of talk about the possibility of dementia and diabetes being linked together. More recently, however, there has been a lot of research done to show that there is a strong connection between diabetes and dementia and Alzheimer's disease. We know that these two diseases are becoming more prevalent, and there are chronic conditions that unfortunately we're seeing a lot more of here in the United States and worldwide. I mean, we do know that we are living longer and we are not as healthy as we used to be back 50 to 100 years ago. Our diets have changed tremendously, and now we are eating more processed foods than we've ever done before. What exactly is the link between diabetes and dementia, and what can you do to prevent this from happening? On today's episode, you are going to learn exactly on all the things that you can do to try to manage and prevent dementia from happening if you have high blood sugar levels or if you have type 2 diabetes. This is your host, Bytyqi. I'm a board-certified APRN here in the United States, and it is my passion to treat and educate all of you worldwide so we can beat diabetes and diseases together. Please consider subscribing to my channel, share this video, and always comment and let me know what your thoughts are. The number one possible relationship is insulin resistance and brain function. We know that insulin resistance is one of the main defects with people who have type 2 diabetes. Insulin plays a role not only in glucose metabolism, but also in regulation of brain function. Studies suggest that insulin resistance may contribute to cognitive decline and increased risk of dementia. We know that insulin is crucial to maintain good glycemic control, and unfortunately, people with diabetes cannot use the insulin that the body is making effectively, and that is what insulin resistance actually means. Studies do show that insulin sensitivity is important for brain function. Therefore, when we have insulin resistance, we're more likely to develop cognitive decline, which can cause dementia and Alzheimer's in the future. Number 2 is type 2 diabetes and the risk of developing cognitive decline. The studies do show that people who don't have good glycemic control, so those with poorly controlled diabetes, are at increased risk for developing dementia or Alzheimer's. Studies do suggest that chronic high blood sugar levels in the blood can contribute to inflammation and oxidative stress, which are factors associated with cognitive decline, unfortunately. Number 3 is both dementia and diabetes share very common risk factors. Things like aging, obesity, physical inactivity, and cardiovascular disease. If you fall in any of these categories where you are not active, you're obese, or you have very poor eating habits, you want to start to fix those first because that is going to be crucial for both managing good blood sugar levels, but also for preventing dementia from happening in the future. Number 4 is vascular complications. We know that diabetes is highly linked to any vascular complications. You may already know someone who may have an amputation or a missing limb because of diabetes. And we also know that uncontrolled diabetes puts you at higher risk for bleeding blood vessels. That's why it can lead to blindness and other complications like heart attacks or strokes. Vascular dementia is a type of dementia that comes from reduced blood flow in the brain, which can be exacerbated by diabetes-related vascular diseases. Therefore, if you have diabetes and it's not well controlled, it can put you at higher risk for having vascular issues. As a result, the vascular issues that can be complicated by diabetes can actually lead to vascular dementia, which is just another form of dementia that we know of. Number 5 is hypoglycemia and cognitive decline. People with diabetes can be on certain medications like sulfonylureas or insulin that can cause low blood sugar levels. Unfortunately, people with these types of medications are very high risk for having low blood sugar levels, known as hypoglycemia. Unfortunately, many people with diabetes have had at least one episode of hypoglycemia in their lifetime. If you've ever had a low blood sugar reaction, you already know that the first thing that usually goes is your brain and your ability to think. A lot of people become confused. Some people can actually have seizures from low blood sugar levels. And therefore, people with severe hypoglycemia events that occur over and over again are unfortunately at higher risk for cognitive decline, leading to dementia. For that reason, we want people with hypoglycemia to get their diabetes under control and adjust their medications as needed so they can prevent these episodes from happening, because people who chronically experience low blood sugar reactions unfortunately will have some cognitive decline in the future, which can unfortunately get worse and progress to dementia. Number 6 is inflammation and amyloid beta. We know that chronic inflammation, often seen present in type 2 diabetes, may contribute to the formation of amyloid beta plaques in the brain. These plaques are a hallmark in patients with dementia that they have been able to study. You're probably wondering, well, what can you do to try to prevent this from happening if you have diabetes or if you have high blood sugars? So let's talk about the important stuff and the things that you can do to take matters into your own hands. Number 1 is you want to manage your blood sugar levels. We know that controlling your blood sugar levels is one of the staple things that you can do to try to prevent dementia if you have diabetes. That is normally through lifestyle modifications, increasing your activity level if you are inactive, eating a well-balanced diet. Just as the FYI, studies do show the Mediterranean diet has been linked to better cognitive function. Therefore, this diet usually includes a lot of whole grains, fruits, vegetables, and healthy fats like olive oil. So you want to incorporate more of these in your regular diet. You want to avoid highly processed foods. Things are high in sugar and, of course, in saturated fats. Those things you do not want in your diet and you want to avoid as much as possible. You want to get regular exercise. You want to maintain heart healthy. Things like controlling your blood sugar, your blood pressure, and cholesterol are very crucial for maintaining your heart health, but also in preventing something like dementia from happening in the future. You want to stay mentally very active. Please note that just because you have diabetes does not mean you are going to get dementia. It just means that you are at higher risk because of all the things that we just talked about earlier. However, the good news is that you can definitely take things into your own matter. You want to make sure you're being followed by your doctor regularly, checking your blood sugars on a regular basis, keeping your blood sugars in target range, and of course, staying active, healthy, and happy and positive. Please let me know your thoughts, and I will see you all on the next video.